senior consultant, Aster Women Children Hospital, Whitefield. And today we are going to discuss about recurrent pregnancy loss. And we have Dr. Krishnapriya with us.
Hello, good evening.
And traditionally, recurrent pregnancy loss means consecutive losses of 3 or more than pregnancy losses before 20th week. And it can impact 2 to 3% of women in reproductive age group. And today we are going to discuss in detail about RPL. Ma'am, shall we start?
Yes. So, when do you say recurrent pregnancy loss? When there are more than 3 consecutive pregnancy losses, which are gestational age of less than 20 weeks, then it is called recurrent pregnancy loss.
Ma'am, are we really waiting till the third loss to investigate the case?
So, here I would want to make it clear that we are not waiting to do all the investigations and to understand why there is recurrent pregnancy loss till the patient go through a emotional turmoil for 3 pregnancy losses. We'll be waiting, any pregnancy loss more than 2, we'll start investigating, we'll start understanding. And if the person has a infertility issue and then conceived, we would start investigating them much before that.
And what are the commonest causes?
So,
Like in first
the
trimester.
causes, coming to the causes, we would divide according to trimesters. So, first trimester, second trimester causes. So, first trimester causes, let's discuss about first trimester causes. So, most commonly, the first trimester causes would be genetic causes. So, genetic causes where the person has to undergo karyotyping for both male and female partners. At times, we might have to send the fetus, like karyotyping also, products of conception for karyotyping to understand the genetics of the conception. So this is the most common thing, and there are certain people who do a lot of tests for the torch, which is obsolete now. So we are not doing any torch testing when the person loses the pregnancy. These are the most common cause in the first trimester.
And who are at risk?
So who are at risk? See, there is no particular age group who is at risk, but we tend to see most commonly is as the maternal age goes high or the paternal age goes high, like above 35 years, and if they reach above 40, it further increases. And coming to this first trimester, apart from genetic causes, there can be endocrine causes like thyroid issues or other diabetes, endocrine disorders. So, and one more thing is there can be inherited thrombophilias where there will be clotting defects which are inherited. So, in those conditions also people do face first trimester losses. And there are certain issues where the pregnancy loss can be unexplained. So this is one of the causes can be expected. Coming to the second trimester, where the pregnancy after 13 weeks. So mother can have abnormal shape of the uterus. It might be because of the septum, there is a growth because of the fibroid, or it can be like the shape of the uterus being different, like they have the 2 uteruses, like bicornuate uterus. So all these things should be kept in mind when the person loses a pregnancy in the second trimester. One more thing is the cervical incompetence as well, where there is a weakness of the cervix. So, but unfortunately we don't have any test to conduct pre-pregnancy to understand the weakness of the cervix, but history makes a lot of difference to understand the cervical incompetence. So if the person has undergone second trimester pregnancy losses, so we do multiple tests like 3D ultrasound, HSG, to understand the shape of the uterus, which will give us the better picture about the shape, so that we understand, and accordingly it can be treated. If there is a tumor like fibroid, that can be removed, and if there is any septal growth, it's called there is a partition in the uterine cavity, that also can be treated by hysteroscopy. And if there is any, if we suspect there is a cervical incompetence, then the person will start monitoring the cervical length from 16 weeks, and once the anomaly scan is done, then a patient has to undergo the cervical encerclage. Cervical encerclage is nothing but where we put in the stitch at the cervix. So as it is impacting 1 to 2% of the pregnancies, so we see less, but it's not. We should be very serious, because as a woman has a lot of. It's a very painful and emotional turmoil she'll be in to lose a pregnancy. And there can be this RH isoimmunization. This is one of the other causes, where the blood groups of the mother and the father are different. Most commonly mothers might be negative and the fathers can be positive. This is the most common cause. And there are certain tests which we do to understand the clotting factors, clotting in the pregnancy, where what happens is there are certain conditions. This is called APLA syndrome, where there can be microthrombi. Thrombi means clots, which they go and block the placental circulation, and suddenly there is a loss of the pregnancy, the fetal death. So these conditions also has to be evaluated in detail.
So can we prevent this recurrent pregnancy loss?
Yes, absolutely. There are certain treatments which we need to be which needs to be started very early in pregnancy. There are a few tablets like aspirin, and at times we might have to start them on heparin injections, where the patient has to take them till 34 weeks. And at times there can be progesterone deficiency also in first trimester. So we supplement them with progesterone. So there are multiple things which can be done and which can be treated.
And coming to
second trimester, the miscarriage is also preventable, as this is most of the times it's the structural defects in the uterus. So these also can be prevented. At the end of the day, mother will be very happy to take the healthy child home. So recurrent pregnancy loss is no more a taboo. It can be treated, investigated and treated. So anything else, Deepthi, we need to discuss? Do you have any other points to add?
Second trimester we can prevent now. Can we prevent first trimester things also?
So we can, prevent means most of the times if it is genetic cause, it cannot be preventable. So we see why there is genetic. So at times it can be simple folic acid supplementation also. And it can be homocysteine levels being high, where we can supplement them with folic acid. And one more thing is, if there are any balanced translocations and all, that cannot be prevented. So there are other ways where mother can conceive without any issues. So coming to endocrine disorders, for sure. So thyroid, sugars, everything to be investigated. So to avoid all this recurrent pregnancy losses, I would suggest every women to go for pre-pregnancy counseling. That will really help to understand in a health spectrum where they are standing and what and all need to be done. What are the preliminary investigations, minimal investigations has to be done, and what pre-pregnancy medications to be started, all that they can understand. So counseling is very important. So any mother, any women planning for pregnancy needs pre-pregnancy counseling. So
Yes.
I think we have very briefly spoken about all the things about recurrent pregnancy loss. So